Hi, I'm Dr. Ananda. I'm an orthopedic surgeon and a sports medicine practitioner practicing in Mount Novena Hospital, Farrer Park Hospital, and Parkway East Hospital. Actually, I would say that as an orthopedic surgeon, 80 to 90% of the patients that come into my clinic for a consult do not require any surgical treatment at all. Most of them actually require just non-operative, conservative treatments to actually address their orthopedic issues. Of course, in my clinic, I would say that as a dichotomy, I see two kinds of patients. One is the sedentary individuals, and the second is usually very active individuals. And the orthopedic problems that plague them are very similar, but it's just the cause of these problems are different. Like for an active individual, a lot of times orthopedic problems occur because maybe they have some training errors, they have some predisposition to some malalignment, and they have not addressed it adequately, and because of the overuse in their training, they actually develop orthopedic injuries. Whereas for the sedentary individual, the problems stem from basically a lack of conditioning of the musculoskeletal system. So a lot of times, the activities they do, which is quite infrequent, sometimes stress the joints, and then they complain of orthopedic issues. Yes, certainly age is a factor in the orthopedic conditions that I see. Of course, accidents do happen, and sometimes fractures or ligament injuries can occur in patients of all ages. But generally speaking, when we talk about age as a factor, what I do see is orthopedic conditions tend to get more prevalent in the patients above the age of 35. Now, the reason for this is because from a young age to the age of 35, we are building bone mass and muscle mass, and it reaches a peak at the age of 35. Now, from then on, bone mass and muscle mass decrease by about 1% a year if nothing is done to actually preserve it. So a lot of orthopedic conditions do occur because patients actually do suffer from muscle loss and poor bone quality, and therefore the risk of orthopedic injuries in a group of patients above the age of 35 is slightly higher. Of course, we also have patients who are female patients who above the age of 45 undergo menopause. Now we know that menopause changes the hormonal profile for these women, and these actually can cause more muscle loss and also bone quality deterioration. As such, it is very common that I see female patients above the age of 45 complaining of joint pains and relatively more orthopedic problems than usual. Okay, so exercise medicine is basically the prescription of exercise as medication, essentially. Now we know that there are various ailments such as heart problems, heart diseases, cholesterol, lung problems, in which doctors do prescribe medications for their patients. And the nature of prescriptions of these medications require a dosage of the medication, a frequency in which they have to take them, and the duration in which this medication should be consumed. As such, exercise can be thought very much like a medication that is given to the patient, in terms of the intensity of the exercise, which is the dosage of the exercise given to the patient, the frequency in which this exercise is actually done, and of course the duration in which it is actually performed. So as such, this is what the essential exercise as a medication or medicine is all about, to actually allow patients to use exercise as a form of medication to actually give them better health. So exercise is important because time and again, studies have shown the benefits of exercise for patients. It helps to maintain a healthy heart. It helps to reduce cholesterol levels in patients. It also helps to maintain a very healthy weight. And it has been shown in exercise that the people who actually engage in regular, consistent exercise actually have lesser orthopedic problems as well. Yes, certainly exercise can prevent worsening of conditions such as arthritis of the joints. Now, exercise requires movement, and it requires movement of the joints. Now, a lot of times when arthritis occurs, it's a disease of the joint, and much of it is because the joint lacks nutrition. So a lot of patients have this misconception that, if I have arthritis and I have pain, sometimes I just need to rest and the pain will get better. But the problem is that this rest and recovery mindset may not be effective in all patients. Sometimes we actually need to give nutrition to the cartilage, and movement of the joint actually gives nutrition to the cartilage. Now, this is the reason why a more active recovery type of mindset will be more useful for these patients, where they actually undertake certain safe strengthening and range of motion exercises of the joints to actually help to make the cartilage cells healthy, to delay the progression of the arthritis. Okay, so people in Singapore enjoy sports such as pickleball, tennis, badminton, football, basketball. Now, these sports have a very nice social element to them, and it's no surprise why patients do like to play these sports because it's a time for them to get together with friends. However, these sports are also relatively challenging sports because you can see that these sports require movement in many different planes. They are actually called polystructural sports. Now, I do see a lot of injuries arising from patients who undertake these sports, mainly because many of them are actually unprepared to actually take the rigors of the sport. And this is also partly because they may not be trained for it to a sufficient extent, and their motivation has always been stemming from the social element of it. I do have to say that it is nice that they actually are even going out to play the sport, and it's completely encouraging that they are doing this, but some little tweaks can actually help them prevent injuries, and this is something that we should just bear in mind. A lot of sports such as these require a lot of different movement in different planes, and basically if patients are getting older, they actually lose some of this neuromuscular conditioning, which is basically the ability of the body to change its direction, pivot in different directions when the sport requires it. And because they have lost some of these neuromuscular conditioning, injuries tend to be more common in this group of patients, who are usually the more older group of patients. So I think there are some good habits that patients can inculcate in their daily life to actually help to reduce the risk of them having any orthopedic conditions and problems. So I would say that a lot of it stems from lifestyle changes. So I would say that if patients have a priority of movement and activity as a lifestyle hack, this goes a good long way in actually helping them maintain a good weight. Number one, it also helps to improve the movement of the joints to make the joints healthy. Notwithstanding, diet and nutrition also plays a very important part in helping to prevent orthopedic problems. Now, we know that for your bones, calcium is extremely important. Now, what helps the absorption of calcium from your body is actually the presence of vitamin D. And in this day and age, a lot of us are not getting enough sunlight to actually produce vitamin D. So supplementation is something that I would strongly encourage patients. Calcium and vitamin D supplementation is important in preventing orthopedic problems. And it's good that we actually check our vitamin D levels regularly to make sure that we are topped up and that we are actually get the supplements are actually helping us. The next thing that is also very important, especially in the elderly patient population who have a risk of muscle loss and sarcopenia, is maintaining good muscle stores, and protein intake is very important in this regard. At least 1.2 grams to 1.6 grams per kg per day of protein is required by patients to actually maintain a good healthy muscle mass. Okay, so last but not least, maintenance of a healthy weight with a sensible diet is important in preventing orthopedic injuries as it reduces the load through the joint. Okay, so as an athlete, as an orthopedic surgeon and sports medicine practitioner, I find the benefits that daily exercise brings to me and my life. And I surely hope that it's something that is in the priority of the patients that I see. Okay, it may be surprising for you to know that many of the movements that we find easy when we are young actually become a challenge when we grow older. For example, patients above the age of 75, many of them cannot do a jump on the spot with their two legs because of the loss of muscle mass and power. So if you're sedentary or active but are keen to start an exercise program, come chat with us at Orthocare Orthopedics and Sports Medicine and let us lead you to the best health ever.